there was a lot of interest in a new agent called an antibody drug conjugate. It's Rova-T. I can't even pronounce its full name, but this was in the setting of small cell and targeting a specific marker called DLL3 that is seen in about 2/3 of small cell cases. And there was a lot of excitement considering that this was still a pretty small study of what's called a phase 1. So really just still looking at dose finding and safety and feasibility.
Can we explain what an antibody drug conjugate is?
So antibody drug conjugate is taking a specific chemo or other toxic approach to the cancer and attaching that to an antibody which specifically hones in on the target in question, which here is a marker,
protein on the surface of the cell.
Protein on the surface of the cell. So it's kind of delivering a payload of anti-cancer therapy in ideally a very selected way.
Okay.
So there are some of these in other settings. We really don't have that widely employed in lung cancer. But so this Rova-T therapy for small cell lung cancer has generated a lot of excitement for a still pretty early process of study. I think in part because it's been looking in the setting of small cell lung cancer, and particularly relapsed and recurrent small cell. We don't have a lot of good therapies. It's been a very tough nut to crack. And so there were responses seen and an encouraging survival, but interestingly, there was a general sense of perhaps disappointment compared to what was expected. Ram, what did you think of this work, and how do you see it moving forward?
So clearly, oncologists and patients are looking for some breakthroughs in small cell lung cancer. And when we heard that there was a drug that can result in tumor shrinkage in about 38-39% of the patients, admittedly, these are patients whose tumors have to be tested for the biomarker, but that's, we're told, about 70-75% of the patients. That is interesting. That tumor shrinkage in 38 to 40% of the patients is interesting. What we were not told at this meeting is how long did these responses last and how long did the drug keep the tumor under control. So I think those kind of information will help us sort where exactly it's going to fit in and what sort of benefit our patients can expect with this drug. Some side effects, majority of the patients did well, but some of the side effects like low platelet count or even fluid collection buildup in the chest or in the abdomen, which happened in about 10 to 12% of the patients, can be troubling if it happens. So I would say it provides room for optimism. They are testing the drug in larger groups of patients, so we'll in short order learn how it fares. And if it plays out well, it has potentially a path towards being approved for use in small cell lung cancer. So I'm optimistic, and I would like to see how the follow-up data play out.
Everett, do you have any?
I agree. I think the concept of antibody drug conjugate is validated in breast cancer. And what we haven't known up to now is, do we have those surface targets, particularly in small cell, to direct something against? And in that sense, this DLL3 is interesting. I think the drug's name is Rova-T. It does seem to have activity. And beyond that, I agree. We need to be cautious. There have been other compounds in the past, and rubicin comes to mind, that have activity that fail to make it, maybe narrowly fail to make it, but fail to make it. But this is a promising drug. I think all drugs land somewhere below the initial hype with further, but my hope is that in the end it will be above the bar for approval.
And it's certainly a setting where we are desperate for new treatments. Janet, other thoughts?
I like that the concept is very similar to targeted therapy for non-small cell. It's not exactly that the drug is going to the protein, but that the antibody is seeking the protein, but otherwise it's still hopefully going to have less effect on healthy cells. I like that.
Okay.